Okay, welcome to the second installment of Medical Law and Ethics. This is Chapter 4, Ethical Issues. We're going to start by talking about what ethics are. So ethics is really your moral principles, your values, anything that impacts how you make decisions, how you make choices, your right from wrong, good from bad, etc. So the criteria for an ethical dilemma is where you have two or more principles that are in conflict when there is no clear-cut right or wrong answer. So when the right behavior leads to the wrong outcome is kind of another example. So to give you an example of this, you make the right choice, you do the right things, but then something wrong happens. These are ethical dilemmas. So with regard to ethical issues in healthcare, we talk about three different principles. So the first principle is autonomy, which is where the patient has a right to make the determinations for themselves. Nobody gets to decide what happens to them except for themselves. Beneficence is where it requires people to do what is best in regard to the interest of others. And then distributive justice is the principle where, as a society, or in this case, a healthcare community, it decides to allocate its resources that are in scarce supply. So, for an instance, autonomy is getting to choose what you want to have happen to you after, death, whether you donate your organs, etc. Beneficence is where you have to do what's best for the common people. We use vaccines as an example in this situation. And then distributive justice is, so let's say with the COVID situation, PPE was in short supply, personal protective equipment, for a long time. So they had to determine who got the personal protective equipment. Obviously, it went to healthcare workers, those on the front lines, and then basically how much they got of it and how many of them got it, etc. So those are the three principles when dealing with ethical issues in healthcare. So distributive justice can actually be broken down a little bit further into four separate categories. So you have the egalitarian approach, which is where everybody gets an equal share of whatever the supply is or whatever's being distributed. The earned approach was those who deserve get more. The libertarian approach is each gets what he or she or they can legitimately get. And then the social justice approach is where you allocate based on the maximum necessity. So this is where we try to help as many people as possible with the limited supply that's available. So if you think about this with regard to COVID, think about which one of the categories did we as a society fall into when it came into distributive justice for PPE for medical professionals in healthcare. So think about that. There are some questions that have no definitive right or wrong answer. These are ethical issues. It really just depends on your personal values, your belief system, how you feel about certain things. So there's a table in your textbook. I don't know the page number and I apologize for that, but this describes ethical issues relating to healthcare. And there's some really interesting things on here that I don't think people realize are actually considered ethical issues. So I encourage you to take some time to look at table 4-1 in your textbook. So here's an example of one ethical issue. This particular ethical issue is abortion. And if you put it into the three principles or the three categories of ethical issues, you have autonomy, which is where the woman has a right to self-determination over what happens to her body. And then you have beneficence, which is another principle, because the fetus cannot speak for itself. Those of us who can should act in the best interests of the fetus. And then you have distributive justice, which is if the procedure is legally available, that it should be available to all, including those that are financially unable to pay for it. So this is just giving you, it's not to spark debate, it's just to give you some information on the three different principles and how it appears in a bioethical dilemma, and in this case, it would be abortion. Another one is cryonics, which is actually where you have your body frozen right after death and the potential that you can be thawed out years later. Once there's a cure for whatever is killing you or what have you, you can be thawed out and then live again. So again, the three principles: autonomy, that says that the person has a right to decide whether he or she wants to be frozen in time in the hope of coming back to life in the future. Beneficence, such an act is not in the best interest of the patient. That is the way that principle reads in with regard to cryonics. And then distributive justice is that if the procedure should not be done until such a time as it's available to everyone. So basically, distributive justice is saying if this is fine, but it has to be done once everybody has the opportunity to do it. It shouldn't just be an elite few that are able to do this because they have millions of dollars or what have you. So another thing that's kind of confusing in the healthcare world are the DRGs, which are diagnosis-related groups, and then capitated payments. I know we just kind of switched gears from cryonics and abortion and autonomy and beneficence and distributive justice, but this is kind of interesting too. So a diagnosis-related group reduces the amount a hospital can be paid based on the diagnosis, irrespective of any complications that may develop. So this can be considered an ethical issue because if you have a patient come in and the diagnosis is septicemia, but then they end up having their left leg amputated, this is an extreme example, but they have their left leg amputated due to the septicemia, but the hospital is in this diagnosis-related group, they can't charge for anything extra other than whatever falls directly under that septicemia diagnosis code. So they might lose a lot of money over and above the care that they actually were given. They're going to lose a lot of money in that situation, which is why it's considered an ethical issue. Capitated payments limits the amount of money to the physician to a set amount each month, no matter how ill the patient might be. So again, you've got a patient. This patient has cancer. They receive chemotherapy and different treatments monthly. The physician can only receive X amount of dollars a month, even though they might be providing services well up and above what they're getting compensated for. So those are just a couple of ethical issues on the other side of healthcare, things that a lot of people don't talk about with regard to ethical dilemmas. So the point of paying providers using diagnosis-related groups and capitated rates hold down unnecessary costs. So I'm sure you've been to an emergency room and you've had to have a scan or something very expensive done that maybe you felt, or maybe somebody in your world felt wasn't really necessary. We could consider that an unnecessary cost. These types of proposals reduce that type of unnecessary testing, or at least unnecessary costs on the patient. The provider's sense of professional ethics is what stands between adequate care and substandard care motivated by the payment structure. So basically, this is put in place to prevent physicians from either not doing their job correctly or overcompensating. So let's talk about diversity. So medical assistants have responsibility to care for everyone. It doesn't matter what color, what race, what ethnicity, what creed, what religious preference, etc. It doesn't matter what culture. We as medical assistants have to take an oath too, just like physicians and nurses, and we have to take care of everyone no matter what they look like or what they believe. And it's our responsibility to accommodate them, not for them to accommodate us. When we get into chapter 5 and 6 after midterm, we're going to talk a lot about communication and the psychology of communication with regard to medical assisting and how that impacts us. Culture is a definitive communication barrier if the medical assistant is not willing to identify these barriers and overcome said barriers. But we will discuss that at length when we move into chapter 5 and 6 after medical terminology. But just a heads up, we have to be conscientious of others and their beliefs and how those beliefs and those systems impact their healthcare. Culture is a shared system of beliefs, attitudes, values, expectations, and behaviors. And then there's subcultures: ethnicity, religion, social and professional subcultures, etc. Again, these are all part of diversity and they fall into ethics. Absolutely. I'll give you an example. This is the one I use often. So you work in an emergency room and there's a patient that comes in from the prison in your community, and this patient had been stabbed. You know who this patient is from the publicity that the case received. Maybe this person has done some really terrible things and it goes against your beliefs to take care of that patient. You don't feel comfortable, you don't feel safe, etc. In that event, what you would do is you would tell them that you feel like it's a conflict of interest to take care of this patient, and then you would have someone else do that for you. But if there's a situation arises that you can't do that, you're legally obligated to care for everyone. You can't say, I don't want to take care of this person because, you know, he's a criminal, like, or she's a criminal, or they're a criminal. Like, you can't do that. You still are expected to give them the same level of care that you would give the little girl that fell down the stairs and broke her arm. Like, it's your responsibility. So this is something that we really need to be conscientious of and understanding of. So some examples of cultural communication considerations, and again, we will talk about this at length in chapter 5 and 6, but there's social values and customs, roles and status. You know, celebrities supposedly tend to get, you know, better care. I can't really justify that. I don't know that that's a fact, but it's, you know, roles and status. There's definitely times where people of excessive status in the world and in society receive things that those that are not of that status do not receive. Decision-making customs, who makes the decision in some cultures? The husband makes the decisions, you know, in some cultures, they both make them together, etc. Concepts of time and personal space, cultural context. Body language is something that we will talk about at length in chapter 5 and 6. It is the most definitive method of communication without using words. And it is something that as a medical assistant, you need to be able to identify, but you also need to be conscientious of your own body language and how it impacts the people that you're taking care of. Social behavior and manners, and then legal and ethical behavior. They are different. Legal means laws. If you break that law, there's a criminal punishment for said breaking of the law. If it's an ethical issue, it could be considered civil, or, you know, in some cases it's not illegal. There's no criminal punishment for it, but it could lead to a crime. So you have to be aware of both of them. An example of good intercultural communication skills is to withhold judgment. We as medical assistants and medical professionals cannot place judgment on anyone. That is not our job. We are there to provide them with the most care that we can. Showing respect, empathy, tolerating ambiguity. You're going to run into people who maybe have cultural biases against you, or don't want you to take care of them because of their own cultural beliefs. You have to deal with that. You have to be able to mediate that and to still give them the best care that you can. And you really need to be aware of your own cultural biases. It's not unlikely that a lot of people have cultural biases and they're maybe not even aware of it. So it's definitely something to do something to kind of evaluate within yourself before you really get into healthcare and realize that you might be taking care of people that maybe you're not comfortable with, and that's something that you need to address internally. Emphasizing a common ground, sending a clear message, and then learning when to be direct. There are times and places for each of those. So to distinguish legal, ethical, and moral judgments. The law and ethics and morals are 3 types of categorizing principles. If the situation is a legal matter, you always follow the law. If it's a moral issue, and the moral issue stems from a belief system in which one makes judgment about right and wrong, then that's an opinion. It's based on moral beliefs and moral value and values. Those are your opinions, and they will differ. That's something that you have to deal with. If the situation is an ethical matter, you want to ask yourself 3 questions. What promotes the right of the patient's determinations about their own health? What is in the best interest of the patient with regard to their health? Is performing or not performing the act in question fair to others? Are you going to hurt other people by doing this for this one person? Those are the three questions that you need to ask when dealing with an ethical matter. So what do you report? Who do you report it to, and when do you report it? So if it's a criminal conduct, to give you an example, somebody's stealing medication out of the Pyxis system at the hospital. If it's criminal conduct, you notify the local police immediately. If somebody is violating HIPAA and improperly disclosing patient information, you can't tell anyone other than the patient or the physician. And in my professional advice to you in this situation is, if you notice someone is violating HIPAA, you need to immediately notify your superior whomever that would be, whether it's an office manager or the direct physician or a hospital human resources department professional, et cetera. You need to notify them and provide them with the evidence of the breach, the violation of HIPAA, and then move forward from there. Provider misconduct, notify a practice administrator or an office manager. So if your physician is not doing their job correctly, you need to notify your superior of that. And then office staff misconduct, you always want to notify a practice administrator or an office manager. So if you see the secretary at the doctor's office is stealing something, that's a crime. But if you see them gossiping about patients, that's a HIPAA violation. That can also be considered a crime depending on the severity. You would want to notify someone immediately. So professional ethics are codes of ethics, prescribed behavior for professionals in many industries, associations, and fields. The American Medical Association has a comprehensive code of medical ethics, and it speaks to a wide range of matters arising in the professional conduct of a physician. But as medical assistants, we have our own creed that we follow. If you get on the American Association of Medical Assistants website, the AAMA, you will notice that there is a code, there is like an oath kind of that we take. If you look up the National Health Career Association, NHA, who we certify through in this program, they also have their own code of ethics or oath that the medical assistants take upon certification. So basically, the code of ethics addresses providers' conduct in interprofessional relations, hospital relations, confidentiality, fees, records, and professional rights, among other things. So just be aware that that is out there, and you're always welcome to click on this link here in this presentation, and it'll take you to that code of ethics. So medical assistants are subject to a code of professional conduct when they join organizations like NHA. That's who we work through when we certify. So I really encourage you to check that out. You can check out table 4-2 in your textbook, and it'll give you that information as well. Something that comes up in your chapter a lot and that I really want you to pay attention to is organizational ethics. I give this example because Ohio Health, for instance, they have the circle, and in the circle, there's all these different components that speak to their creed, their code of ethics and how they function. And I encourage you to check that out sometime if you're not familiar with it. But that is their organizational ethics. It represents the values by which the organization conducts its business. Often, organizations include a value statement as part of their mission and vision statements, and in this case, Ohio Health does have a value statement. These reflect organizational cultures that value their employees as well as their patients. This is something I really do encourage you. Again, Ohio Health. I'm only familiar with theirs. I don't know anything about other systems, but I've seen Ohio Health's circle in their code of ethics and stuff before, and I really encourage you to take a look at it. So there's 4 characteristics in the organization that encourage ethical behavior. Their code of standards, training. Training is really important, and it's something that I feel like a lot of facilities fall short on, especially smaller privately owned facilities. Your larger corporate facilities tend to have a better training process in place, but you can't work efficiently if your employees are not meeting the needs of the facility and the community in which it serves. So training is really important. Availability of advice for employees with regard to ethical issues. There needs to be somebody on site that can help guide you if you run into a situation. And then a system for confidential reporting. These are the 4 characteristics in the organization that encourage ethical behavior. And then we'll talk about personal ethics and professional performance. So professional and organizational ethics are designed to inform your professional performance. These are systems of assessment, basically, to ensure that all employees are meeting the professional performance and personal ethic requirements of that facility. Regardless of your personal perspective, you must adapt your personal views to be in complete alignment with the ethical standards of your profession and your organization. This is really important information that I encourage you it's almost like doing like a check-in with yourself, like a self-assessment. Figure out where you are ethically, morally, etc. And then how does that line up with your prospective employer? This is something that I encourage everyone to do prior to seeking employment in healthcare, because if your views and values don't line up and you're not willing to adapt to those views and values, then you're not going to have a successful employment with that organization. So just a heads up on that. Okay, I hope you guys have a great day. Thanks.